Welcome to Design Nerds Anonymous, the podcast that sparks curiosity at the intersection of business and design. I'm your host, Amanda Schneider, founder and president at ThinkLab. Now, over the next few weeks, with the help of my fellow podcaster, Kaylin Reed from the Alternative Design Podcast with Kimball International, we'll be sharing nuanced insights around each of four vertical markets: corporate, education, healthcare, and hospitality. This is episode 3 of 4 in our current mini-season. Think of this mini-season as a prequel to season 6, which will release this fall. We'll dig even deeper and offer more ideas, tools, and insights to help you fuel inspirational discussions within your project teams. All right, so let's explore our research. In this episode, we'll share insights from the health and wellness sector. We've recently conducted 6 months of research with decision makers for the built environment from hundreds of companies, including Johns Hopkins, Lurie's Children's Hospital, the VA, several behavioral health institutions, and many, many more. So, what can we all learn from the health and wellness sector? If you haven't tuned in to the other episodes this season, I want to suggest that no matter where you typically focus, we'd encourage you to go back and have a listen, because there's so much we can all learn from each of these vertical markets and how these challenges are taking shape. Last week, we talked about the not-so-hidden culprits affecting decision-making in the education sector. And one thing that plagued both that sector and our healthcare sector won't surprise you. It's bureaucracy. But it presented much differently in the health and wellness sector. We've titled this episode, "The Paradox of an Un-rushable Process in Fast Times." So let's explore what we mean. To get us started, we asked our healthcare research participants to share one word that describes how the decision-making process has changed in the past few years. The quotes you'll hear next are anonymous quotes from healthcare end users from our research sessions, followed by 2 of our A&D hotline callers.
My one word is streamlined. I'm really trying hard to focus on what we really need, and I can't have outliers affecting our decision making.
I'd say evolving. We have a new parent company due to the rapid evolution of acquisitions happening in the healthcare realm. The levels of approval and where they come from has really shifted in the past few years. We often don't know who has final say just yet. It's still evolving.
Hi, my one word is standardization. This is where we are headed. Our leadership thinks this will ease our pain, but until we fix this process, in my opinion, it won't.
I'd say roller coaster. We've been given the directive to do standards, but our budgets have also been cut, so we aren't able to execute. Budgets and availability have been all over the place.
Hi, this is Geraldine Drake, and I'm calling from AECOM, and I would say our one word is innovative, and I think that surrounds, in healthcare especially, more process-driven on measurable outcomes.
My name is Mary Porter. I'm an associate principal at HLG Studio in Atlanta, Georgia. My word for the current project process would be experiential. How can we bring our years of experience to that project when we walk into that construction site or walk even into those design meetings to ensure that we are prepared, we're productive, positive experience for that user, and the final outcome has both a positive impact in the patient experience, but also then to really support the staff in their day-to-day tasks.
So to summarize, common words used for the health and wellness sector were streamlined, evolving, standardization, roller coaster, and my personal favorite was from one interviewee in the nonprofit healthcare sector who used the word quicksand due to the incredible variation in project size, volume, and again, that bureaucracy to get the long, slow projects to come to fruition. As many of us know, when it comes to projects, these large healthcare projects can be several years running. And in this day and age of rapid change, so often, by the time the products or materials originally selected on a project are funded, approved, and finally get ready to be built, the world around these drawings has changed. In these projects, sometimes spanning over multiple years from drawing to move-in, products and materials selected can be cost prohibitive due to price increases, availability, or simply because the right people weren't in the room for the decision-making process. They often come with reasons why the built environment won't work for them, even though, at this moment, late in the game, they're technically new to the design and construction team. So let's look at where in the project process there's the most pain in decision-making for the healthcare sector. Now, our talented data visualizers at ThinkLab created a heat map that shows where each vertical is feeling the most pain. The more intense the color, the more consolidated the pain was for our research participants. Now, healthcare was different than any other sector. Their pain was the most evenly spread across all the phases of the project process. And we believe where there's pain, there's opportunity for positive change. So, in healthcare, we certainly saw a lot of opportunity. Here's one of our Atlanta event participants, a trained designer, now an end user from the hospitality sector, commenting on one of the things that surprised her most from all of the research that we presented at the live event.
I was surprised for the healthcare. You mentioned that it was peanut buttered across the pain points for them. That kind of broke my heart a little bit. When I first went into design, I thought I was going to go into the healthcare realm because there is just solutions there just are so valuable to the crowd that they're serving. So it's a little heavy-hearted to realize and see that's still such a pain for them across the entire process to get to a solution, to be out there in the field for the people that really need that solution.
So why the evenly spread, or as we like to call it, peanut buttered pain? Number one, they struggled to find the right partners that, quote unquote, really get it. We all know that healthcare has specific requirements, from behavioral health institutions that have to keep their people safe, to hospitals that have to meet specific code requirements. More than any other sector, we heard often from these internal design teams that they struggled to find project partners that really get it. This applied to both the external design partners, who several mentioned seemed to be missing things on drawings that previous teams would have caught, perhaps due to the pace of change, to product partners that understand the unique and nuanced requirements for behavioral health versus cleanability for hospitals, and so on and so forth, to even the nuances of finding a contractor that really understands their protocols in construction.
The level of specialization that we need for health and safety requirements adds an entirely different level of complexity. And we have to make sure that we have the right partners in place and get infection prevention team involved. We need a contractor who understands our protocols and requirements, and design teams who have the technical expertise, so I'm not spending all my time redlining. We have 2 or 3 go-to partners, but many don't get it.
Number two, we've heard this from other sectors, more decision makers involved. Now, for healthcare, this was incredibly nuanced. As you heard in the last 2 episodes, this was a pain point for corporate and the higher education sectors as well. And spoiler alert, it was a top pain point for all, with over 40% of decision makers who responded to a recent ThinkLab survey citing this as one of their top 2 pain points. But here's the nuance for healthcare. Though their pain was even across all sectors, more decision makers wasn't necessarily a bad thing. Decisions for the healing environments are getting more complex, which means they need more specialists at the table. So who are these decision makers? We heard ideas ranging from infectious disease specialists to IT, with new technologies being incorporated, to brand experts in the area of acquisitions and integration in the healthcare realm, to, of course, design, especially as mental health for our healthcare workers becomes such an important topic. Here are a few direct quotes from our research.
The C-suite is involved more than they used to be. Used to be just COO. Other executive leadership across the hospital, executive nursing director to executive director of facilities, ambulatory directors, so many positions come to the table for these cabinet meetings.
Higher ups have gotten more involved to help maintain brand standards that have been developed recently.
And the third and final reason for pain is conflicting stakeholder perspectives that sometimes lead to what we'll call buyer's remorse. Now, most projects across all sectors have multiple stakeholders that may have conflicting priorities. And while this isn't new, it's certainly intensified. For higher ed, it's faculty and students. For workplace, it's leadership and employees. For hospitality, it's owners and guests. And of course, for healthcare, it's all of the aforementioned players who are making decisions, but also physicians and patients. Healthcare experienced notably more pain during the move-in and implementation phase than any other sector. And no doubt, it's directly related to what we heard in the last section about more decision makers involved. Yet, when it comes to the end of the project, there were still often surprises. So here's what we heard. People, most of whom were not involved in the initial design meetings, for example, physicians are often surprised at move-in when they didn't get what they were expecting. But they're often seeing this for the first time at the end of the process. The project is already done and often out of funding to make changes. Here's a direct quote from one of our research participants.
At move-in, people realized things that they needed, but it's already done. Everything was on hold for so long. We really didn't reevaluate anything. There's a disconnect where they realize they need things that were never voiced along the way.
All right, so I want to give a big thank you to all of our interviewees in this episode who put the anonymous in Design Nerds Anonymous, as well as our hotline callers, Geraldine and Mary. Now that we all have this collective perspective and understanding, in the second half of this episode, we're going to give you context, ideas, and insight as to how we might collectively help solve these challenges. So with that, I'm pleased to bring back my co-host, Kaylin, who's going to give us a bit more perspective on this sector.
Hey listeners, this is Kaylin Reed, and I'm a design futurist at Kimball International and the host of the Alternative Design Podcast. Amanda invited me on the show to help draw some parallels between ThinkLab's latest hackathon results on the future of customer decision-making and what we're seeing more broadly in these sectors. As a foresight practitioner, my job is to look for data and trends that are happening in the design industry and beyond that spark uncertainties about our future. I dive into those uncertainties to identify future possibilities, or what we call scenarios. From there, we can start to establish potential threats or opportunities that will help guide today's decision-making for tomorrow's reality. We do this and much more on the Alternative Design Podcast, which you should totally check out after listening to this episode. And stay tuned for our new season this fall, which will be all about the future of healing spaces. And just as the hackathon results revealed 3 major pain points, I'd like to briefly discuss 3 major trends that we're seeing that we believe could shape the future of healthcare decision-making. Let's start with the first one, digital twins. Simply put, they're a digital model of a process, a product, or a service. But unlike a Revit model that's just a static copy of a building and its systems, digital twins are actually active, predictive, and can simulate real-world conditions. Imagine being able to create a precise virtual model of a healthcare facility that not only reflects the physical attributes, but also simulates the daily activities of both physicians and patients. We could test different scenarios, predict outcomes, and identify potential bottlenecks or inefficiencies of the design way before the building is even constructed. Remember some of the frustrations voiced earlier in the episode about the difficulty in finding project partners who get it? Digital Twins offers a collaborative platform where architects, designers, healthcare professionals, and other project partners can see a clear visualization of how design choices can impact healthcare environments in real time. Philadelphia-based Thomas Jefferson University is using an AI platform called Big Bear AI that allows the hospital to do this so that they can observe and respond to potential future stress scenarios. The predictive analytics that digital twins can generate could become a total game changer in proactively adjusting our designs to better meet the needs of busy physicians, patients, or other stakeholders who may not have had the time to fully engage in the design process. Okay, the next trend I want to bring to your attention is additive manufacturing, also known as 3D printing. While hospitals have been using 3D printing technology since at least 2010 to create models of human tissues and organs and even medications, it hasn't become mainstream in the building and construction of healthcare facilities. But I believe additive manufacturing is poised to be a big disruptor to watch, as it could bring radical changes to the design-making process for healing spaces. Remember earlier in the episode where Mary from HLG talked about the challenge of adapting to evolving medical equipment needs during the design process? Additive manufacturing promises rapid prototyping and production of custom parts as equipment needs change. And aside from medical equipment, there is, of course, opportunity in the design and construction of medical facilities themselves. Now, currently building codes are tying up the adoption rate of 3D printing for commercial structures, but we could see a combined pressure driven by the demand for climate-friendly building practices, the desperate need for more housing, and the increasing mismatch between material supply and demand. These could actually create a push for the technology to become mainstream in the commercial sector, which, of course, would include healthcare. Okay, the third trend we're witnessing is the fracturing of the healthcare campus. Traditional, large hospital campuses are giving way to smaller, specialized facilities that are spread out and often can include new partnerships. Many of these partnerships include retail giants like Kroger, CVS, and Walmart, who are all trying to incorporate clinic spaces within the store. This approach is wonderful for the patient. It can improve access to care and streamline services. For those involved in the design of these spaces, we now have potentially new challenges in the design and coordination of these spaces. The increasing focus on localized care aligns with what we heard earlier about the desire for experiential design. These community-focused health spaces can be tailored to the specific needs of the populations they serve. If we see this trend continue due to the demand for convenient, personalized care and wearable device advancements that make it way easier for patients to self-diagnose or even self-treat themselves, this could mean a few things for the future of customer decision-making within health. Smaller facilities could mean less red tape and potentially faster decisions that could be made more locally without the bureaucracy of major hospital systems. But we could also see major health systems wanting to uphold their unique brand in these facilities, which would increase the input of top stakeholders. The fracturing trend also emphasizes integrating healthcare into the community, meaning that designers will now need to consider the building context of where these new health spaces are emerging, whether that's in the workplace, a retail store, a public library, or some other non-traditional health space. So with those trends in mind, I'd like to turn it back to Amanda to give us the practical steps that we can do today, armed with these new insights.
I always love Caitlin's perspective, so much so that for the final section of this episode, I've invited her back to join me in a dialogue to help all of us digest some of the fantastic ideas that we've gathered as part of this research. To close out this episode, we want to make sure that we're following our own advice with sense making to cover all of these insights. Let's dive into our first idea. This was an idea that came directly from our healthcare end users. And the idea is create your own report card. Now, you heard earlier in this episode that this sector probably struggled the most to find partners who really get it. They often have nuanced needs. There's different requirements or different safety needs or cleanability needs. And they were often the most frustrated with their partners. So the idea of creating your own report card was, how could our product or service partners really proactively create literally a report card for a client to see their proven performance? We know that this sector is particularly risk averse. We heard quotes like, I don't have time to do all the research, so tell me how to do it better, faster, smarter. I love this idea in our 5-star rating world where we're so used to being able to look up Amazon reviews or look up Uber ratings, doing that for yourself to help bring that visibility.
I know within the design industry, it can be a little bit challenging because we have a lot of different certifications that mean different things, whether it's level or sustainability and LEED. We have all these multiple certifications. Something that I've been hearing in the industry is, how can we streamline that approach to create something that is actually able to translate across the board? I think that we need to be thinking about what does this report card consist of? Whether that's past history of success, because if that's a durability thing, or if that's just the life cycle of the product, or it really held up when I sprayed it down with bleach 9 times, whatever that is, I think it's going to be really critical to come up with something that can be translated broadly and something that's agreed upon, because in the design industry, we're still trying to get some of those certifications really streamlined so that they can communicate and mean the same thing.
It's interesting that you brought up the sustainability metrics, because I do feel like that's one of the most confusing categories. And I have to say, this was super interesting to ask about with our end users, because they range from one confidential participant from a major healthcare system who is very far ahead on the sustainability front, who could have delivered a masterclass on sustainability, to other healthcare entities that were like, we don't care about PVC in the flooring at all. We're putting PVC in catheters, so could not care less. But I love this idea of whether it's sustainability, whether it's performance on projects, whether it's something that proves your knowledge there, and almost gives them a visual to rank other partners against you. If you want to say, this is how we ranked ourselves, or here's our report card, we would encourage you to take this to your other vendors, your other partners. And I think that level of transparency builds trust. All right, let's move on to our second one here. The second idea that came from this healthcare sector directly with these end users was help them connect recommendations to life cycle value. We were just talking about sustainability. I would say a majority of our healthcare end users were like, we care more about durability than sustainability. One of the most important factors to them is durability and longevity. We also had an idea that built off of this from our New York group that was talking about refocusing decision-making from space decisions to value decisions. And I think it's really interesting, especially as we just talked about how some value sustainability metrics and some maybe less so. How do you identify what your client most values and really help them focus decisions around those topics?
From a future perspective, I think that we could increasingly see some disruption in this durability conversation. And the reason I say that is because as we have AI that's able to come up with thousands upon thousands of new materials that we have never seen or known before, something that we could be looking at in the future is having new material advancements that check the box on durability and the value decisions that you're speaking to. Right now, we're moving more and more away from these very clinically sterile environments. But when you look at that practically, you can't specify a boucle fabric in a waiting room. It becomes this challenge of how are you able to uphold maybe an aesthetic value decision and marry that with the durability. We could very well see a very near future where both boxes are in fact checked. What would it be like to encounter a material that truly has the feel and tactile sensation of velvet, but you can bleach that sucker down 19 times in a row and it's going to be just fine? And while I realize that speaks to more of a future state, I bring that up because it's something that we need to be considerate of as we see investments in these new materials that are going to be surfacing within the next few years.
I think it's so interesting that you bring this to AI. And I know that AI can be almost as polarizing as the back to the office conversation. But I want to pick on that a little bit because I think one of the interesting things about AI is there's all this noise in the media around it. Yet, even with the tools that we're comfortable with, try to Google healthcare fabric today, and it's going to bring you a bunch of things that are not at all probably what you're looking for as a design specifier or as an end user for your space. It was really interesting in the healthcare sector because we had someone who came from behavioral health that was growing so fast that he and his team could not keep up with the growth that was happening. And he was asking some of the other decision makers in this end user session for some help in really connecting with people on the dealer side that have this specific expertise of how do we find the right products that are going to work well in a behavioral health environment. As a futurist, help connect the dots between Google can't even get me to a healthcare certified, and AI is going to revolutionize how everything's going to be done. From a process standpoint, how might that look different?
What I'm bringing to the table from a material advancement standpoint, I think is what AI is really amazing at in terms of having a generative opportunity to create new and novel things that we haven't seen. What I'm saying that AI can do is what would have perhaps taken us 5 or 10 years to come up with these new material structures. We have an opportunity to iterate faster than we ever have before. which could reach to new materials, new design solutions, new creative opportunities. And that's, again, what I think AI is wonderful at. But what I'm hearing you say, Amanda, is that AI is really great for some things and it's not so good for others.
I think what I'm trying to get at is also, especially for the non-futurist who's hearing the media and AI is going to revolutionize everything, yet I go to tools that I already know that are maybe a little less scary than AI tools or training your own GPT model. And I can't even Google how to find the product that I'm looking for that's specific to a healthcare space. So I was just hoping that you could help rectify that gap that I think probably a lot of our listeners are going to have.
I would say that for the new person coming to the AI conversation, we all come with our own priming and our own bias as to how we want to see it. I tend to be more of an optimist around AI, or at least in the fact that what I think it can do, but recognizing its limitations and recognizing the inherent bias. I will say that when it comes to material advancements and being able to iterate and come up with new generative ideas, that's something that AI is really able to excel in right now. But it's really up to humans to use AI as a generative tool to create new materials and find the opportunities that work within that. But to your point, for this particular industry, in this particular sector, healthcare is an extremely niche field. There is a subset of data, the T shape that we discussed in the last episode, that goes very deep for health because they all have very nuanced requirements. Where are the gas lines put? Where are the med lines put? When we look at plans, there are very certain pieces of the healthcare floor plan that must be in place for things to operate effectively. Earlier in the episode, one of the guests had actually made a comment about floor plans and drawings, and the fact that several years ago, the partners that they're working with that could have identified some of those inconsistencies and errors in the floor plan, nowadays it's getting missed more and more. And it's so detail heavy and so detail oriented. And I do think that what we are seeing right now is the opportunity for AI to check for accuracy. It's able to be taught how to check for errors, inconsistencies, conflicts, even within MEP. I think there is an opportunity for AI to be leveraged and trained. And this is going to sound crazy, but does the design industry have an AI health mentor? What would it look like for these decision makers to have this design health AI mentor that can actually be that repository of deep expertise and deep knowledge that could actually help them with some of these decision making processes? And that's where this sector has perhaps the most opportunity to make really tangible investments in this technology that could be trained in some of this deep expertise that's needed for health.
I think you're going to provoke a lot of our listeners. So if you want to share your thoughts at the end of this episode, you're going to hear about how to leave a message if you've got something to add to this conversation. Let's move on to our third and final idea for this healthcare sector. And this was all around visualization. The idea was help them corral decisions through visualization. And you may hear that and be like, no, duh. We've been using renderings for some time. But there's also technology, not only like AI, but VR to help staff and clinicians really experience the space beforehand to help reduce what we talked about earlier in this episode of almost like buyer's remorse. If you recall, what we were hearing is that these physicians were getting to the space when it's already built out and being like, this isn't what I need at all. Sometimes because technology has expanded since the space was designed, sometimes because they just didn't feel involved in that process. And I think this is where maybe our healthcare sector could learn a little bit from hospitality. I've seen several hospitality firms that do this because it's so expensive to build out a spec room where they use VR. Some of them even have VR spaces so that they can literally walk through a room. How can we leverage all of this technology that's available to us to really help all of these expanding decision makers better visualize the space and see it so we're not getting this feeling of buyer's remorse?
There are increasingly more and more VR tools that are able to be leveraged for the built environment. Physicians don't often have a lot of time. So I think physicians are needing something that's going to give them a real sense of what's going on very quickly. And the opportunity to pre-experience the space, people can explore a Revit model in real time and put a headset on and understand some of the spatial implications. We're seeing digital twins as an opportunity for that. A digital twin is just taking a space and it's actually creating a digital model of that space. But where it gets really spicy and really interesting is the predictive analytics that can come from said digital twin. You can actually pre-experience the experience, right? There's an opportunity to be able to understand the fluidity needs. And something I want to bring up too, when you think about perhaps even a hospital, think about the pandemic, think about what we just went through in terms of how that changed dramatically the need for space in certain departments. And so what does the influx of patients do to the built environment? And what are the new needs that we see, whether that is, again, from a global pandemic or natural disasters due to climate change? There's clearly these huge influx moments that need to rapidly change the way space is done. And digital twins actually have the opportunity to create predictive data sets that can actually help decision makers understand, okay, if this were to happen, how would we need to change the space? There really is increasing opportunity with technology to really be able to help to make decision making easier, especially with an industry that is really volatile.
I actually love that you're bringing up these digital twins and the technology aspects here, because I do think that healthcare is really, uniquely suited. Another idea that came up from one of our anonymous healthcare participants was the idea of even who you take through this digital twin. As you mentioned, some of these physicians are very busy. They don't have time to really fully immerse themselves. So one of our healthcare end users actually created a committee of physicians for physical space, knowing that a lot of these busy doctors don't necessarily have time to get into the weeds and get into the details. So could you take this committee through this digital twin and allow them to leverage their collective expertise to have a dialogue around it? For that particular end user, it really reduced the need for changes after the fact once that built environment was completed. Well, that's it for this episode, folks. But we don't want the launch of this mini season to be the end. We hope it's the beginning. So if you're a decision maker in the health and wellness sector, or maybe you frequently work on projects for this sector, we'd still love to hear from you. What have we missed in this report out? If this sparked something for you, I want to personally invite you to call our hotline. The number is 917-934-2942, and feel free to leave us a message. We're preparing for season 6 of this podcast, and you may just find your voicemail included. Then stay tuned next week for our episode on why this bad word became a must-have for multifamily and hospitality spaces. Our goal with this mini season is cross-pollination. So even if you don't work in that sector, rest assured, we feel confident there will be something in that episode for you. All right, we'll talk to you next week. This episode of Design Nerds Anonymous was produced and edited by Sandow Design Group. Special thanks to Hannah Vitti. Design Nerds Anonymous is a proud member of the Surround Podcast Network. Discover more shows from Surround at surroundpodcasts.com.